Hello, my name is Madeline French. I'm a dietitian working at the University of Utah, and I'm here to present Journey to Health, an experiential nutrition pilot program for Utahns living in underserved communities. And if you happen to be at the conference in person, I'm co-presenting with my colleague, Dr. Christine Jordan. Journey to Health is a free 5-month nutrition education pilot program that was designed to reduce health disparities in underserved communities and empower people through education to improve health and well-being. We offer this program in 4 different communities around Utah with disproportionately high rates of poverty and chronic disease, with concurrently low rates of health insurance. These areas include West Valley, South Salt Lake, Kearns, and Glendale. So the way that the program is set up is that participants are invited to attend 9 activities, which includes 2 biometric screens, a pre and a post, 4 nutrition classes, 2 dietitian-led health coaching sessions, and a community meal and discussion. Some of the unique elements of Journey to Health include its focus on affordability and culturally relevant recipes and cooking demonstrations. We also include incentives at each of our 9 touch points. Some of the incentives include food from the Utah Food Bank or grocery store gift cards that participants can use. In the upper left-hand side of the poster, you can see some of our flyers in both English and Spanish advertising the different activities that are associated with the program. We try to hold the nutrition classes in the evenings. So as you can see on the poster, it says that this particular class is meeting on Thursdays from 6 to 7 p.m. And we try to do that for working individuals so that we're not, basically so that folks can come after the work day is done. In addition to having our flyers be in English and Spanish, we also have Spanish language interpreters come to each class. So we do advertise that the program is available in both English and Spanish. And how that works is I, as the instructor, will say something in English, and our interpreter will interpret that into Spanish. So it's not 2 separate cohorts, one for Spanish-speaking folks and one for English-speaking folks. We do them all in one class, which is a really great experience, I think. We collect both quantitative as well as qualitative data. So as far as quantitative data, we collect skin carotenoid levels, which we use as a proxy measurement for fruit and vegetable intake. And we collect these at baseline and month 5. And as many of you probably already know, carotenoids are a specific type of antioxidant found in red and orange fruits and vegetables. So for example, things like oranges would have carotenoids, carrots, anything like a bell pepper would have carotenoids, anything orange or red. So we bring, it's a small device. It's a non-invasive device because we're basically just using a little scanner. So there's a light that shines a light on a participant's hand and is able to read their skin carotenoids from that light exposure. So it's a non-invasive procedure that is really easy to do in the community. And participants really enjoy knowing, oh, what's my carotenoid scan? I'm really interested. And it's always fun to see at the end of the program, seeing those participants who have improved their carotenoids and feeling really good about it. The second type of data we collect is qualitative data. So participants self-report behavior modifications and suggested areas for program improvement at the community meal and discussion. So during our community meal and discussion, we get a catered meal, we sit down together, we eat, we catch up because I haven't seen the participants in a while, ask each other how we're doing, and we talk about things that we've been working on as far as some of our healthy eating and movement goals. And in sort of a focus group format setting, I asked participants, what were some of the behavior, if you made behavior changes as a response to this class, what were they? Additionally, we asked them, what other information do you want from us? What did we miss? Are you interested in learning about the gut microbiome? Do you want more information on food access? That sort of thing. So, and this is really for program improvement and so that we can be responsive to the needs of the community. So in the middle of the poster, you'll see a couple, some panel images. And on the left-hand side, we have behavior changes that were most frequently reported at the community meal by participants. The first of which was reading nutrition facts label. This was by far and away the most common thing people said. I didn't know how to do this before class, and now I'm consistently doing it at the grocery store, and I'm teaching my kids and my family members how to do it as well. So that was really exciting for us. The second behavior change was eating subjectively healthier food. So I say subjectively because participants tell me, I'm eating healthier. I obviously am not in their house with them. I can't verify the quality of the foods that they're eating, but in their minds, they are eating healthier. The third is they are preparing more meals at home, which is exciting because we do talk about the difference between nutrient content for foods that you get out versus at home. Typically speaking, foods that we get out are going to definitely have more saturated fat, more sodium, that sort of thing. And then the fourth most frequently reported behavior change is that folks tell me they're using alternatives to salt and sugar, which is really great because this is the big focus of our fourth nutrition class, where we talk about healthy snacks and beverages and how do we make snacks and drinks that taste good without having to add a lot of sugar or salt to them. Just to the right, we have our suggested area for program improvement. So these are things that participants tell us they want more of or they think that we could change. The first of which was that they're really interested in having more cooking classes or more food demonstrations. During nutrition class 1 and 4, we do food demonstrations. So the main photo at the top of the poster, this is us making agua frescas in class, which we basically do by kind of blending cucumber, lime, and mint in a blender and then combining it in a pitcher with some ice and water. And this is basically showing our participants, hey, we can make this yummy drink that we don't need to add sugar to. And folks get really excited. They love when we do cooking demos. They want to have it be a little bit more hands-on. So in response, we are currently working on creating some cooking classes that we have been able to do as we found some additional grant funding that is going to help cover the cost of doing cooking classes with our participants. And they're very excited about our first one is coming up in November, and it's going to be Dia de los Muertos themed. So excited for that. The second suggested area for improvement was folks mentioned they wanted more information or a greater emphasis on physical activity. Currently, physical activity is not really mentioned in our curriculum. This is something that participants talk when they're doing their one-on-one visit with the dietitian on the wellness bus. They would be making a movement-related SMART goal. However, it's not really currently a main focus of the class. So this is something that we're going to incorporate in future curriculum. The third area for improvement was folks are interested in having more information on prevention and management of specific chronic diseases. So they were asking, can we have a class like this that focuses just on diabetes or just on hypertension or heart disease? And the last area for improvement was folks want to have their kids be able to come to class. They want to have this be something that their entire family takes together. So we're currently looking at what are some of our options for family programming. Okay, so let's look at the graph at the bottom of the screen. We have our quantitative results, and this is having to do with our skin carotenoid scan. So like I mentioned, we take the skin carotenoid scan, we do this during our first nutrition class, and then we do it again 5 months later during the community meal. So as far as pre and post, we saw a 4.6% increase in skin carotenoids, which we felt pretty good about. So at baseline, they were at 31,993. Month 5, the average skin carotenoid was 33,455. And for reference, the average carotenoid score of just a typical American is 20,000. So this is really great. We know that our Journey to Health participants, obviously they're coming to a nutrition education program kind of on their own time. So these might be folks who are already more interested in health and well-being. So we see that they are actually starting out at a little bit higher of a carotenoid score than our average American. I think it's important to note that skin carotenoids can be affected by cigarette smoking as well as UV ray exposure. So if someone has a job where they work outside or they don't wear sunscreen often, they could have a lower skin carotenoid score despite them eating a lot of orange and red fruits and vegetables. So at the top right, we see a picture of a class. This is a good example of what a Journey to Health class looks like. For this particular class, we had 2 of our nutrition graduate students co-teaching. And Journey to Health has been a very great, kind of like a community volunteer opportunity for our nutrition students. So it's a good way for them to see kind of what does a public health or a community dietitian do? What does their job look like? And students really enjoy working directly with participants and being able to provide education to their community members. To give a little context about who are the Journey to Health participants, we had about 143 participants within our first year piloting the program. 45% of those participants indicated that Spanish was their preferred language. And 56% of participants attended at least half program activities. And we count that as going to at least 2 of the 4 nutrition classes, at least 1 biometric screen, and then at least 1 one-on-one health coaching session with a dietitian. I want to back up and talk a little bit about the biometric screens and the one-on-one health coaching sessions with the dietitian. So as I mentioned before, this program is a collaboration between the Utah Center for Community Nutrition, the Utah Food Bank, and the University of Utah Wellness Bus. So I want to give a little bit more context to the Wellness Bus. So the Wellness Bus is a free mobile health clinic where community health workers take biometric screens for folks, and people on the Wellness Bus speak English and Spanish. So again, we're trying to make sure that this is something that's accessible to most of our community members in Salt Lake County. And some of the tests that the Wellness Bus offers include blood glucose, hemoglobin A1C, blood pressure, height and weight, as well as a full lipid panel. So that is going to include cholesterol, LDL cholesterol, HDL cholesterol, and triglycerides. The bus drives around to different communities in Utah every day of the week. So we hold our classes at Wellness Bus locations so that we're kind of meeting our participants or our clients where they're already at in their own communities. The Wellness Bus also has a dietitian on board. She does health coaching sessions with individuals, and she is the one who does the health coaching sessions with the Journey to Health participants. Some future directions for the Journey to Health program. I already mentioned that we are collaborating with local chefs to host more cooking classes because that's been something participants have really said we want more of this. So we are trying to hold classes that highlight the health benefits of diverse food heritages. The first of which, as I mentioned, is going to be our Dia de los Muertos cooking class in November. Another future direction of the program is we are going to be hosting 2 nutrition graduate students who are going to be working with cultural advisors, as well as Journey to Health participants, to create culturally tailored renditions of Journey to Health for the Latino and Pacific Islander communities in Utah. So this is a part of the students' thesis alternative projects that they'll be doing as a part of their degree requirement. Funding for Journey to Health comes from a generous grant from the Intermountain Foundation. And at the bottom, we have our references. So thank you so much for viewing our poster. Hope to see you in person, and if not, to connect with you online. Thank you very much.